Okay, so this is chapter 5. We're going to be covering intellectual disabilities. Okay, so I wanted to start with this quote from Einstein that says, "Everybody's a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid." So the point of this quote is just to illustrate that intelligence is very tied to context and expectation. And so when we're thinking about intellectual disabilities, we want to keep that in mind that intelligence should be thought of as adaptive to particular contexts and particular situations. Okay, so in the DSM 5, intellectual disability, or ID, has replaced the term mental retardation. That term, retardation or mental retardation, is no longer used in the DSM. ID, or intellectual disability, signifies significant limitations in mental abilities. So this is difficulty in the area of reasoning, planning, or judgment. So these are the three main areas that people with IDs are going to have difficulty with. And the important thing to keep in mind here is that in order to get this diagnosis of intellectual disability, an individual has to have impairment in adaptive functioning, meaning there has to be difficulty getting things done in their day-to-day life. So social and practical skills have to be impaired. So we're not simply measuring intelligence and giving someone this diagnosis. It has a lot to do with day-to-day impairment. And then the other main thing to keep in mind about intellectual disabilities is that they are early onset disorders. They are, as we've been talking about, neurodevelopmental disorders. These are not things that people typically have onset suddenly in adulthood, but rather these are things that are basically online early in development, if not all the way in infancy. So we're going to talk about the three components of the diagnostic criteria for intellectual disabilities. We're going to explain how historical views on intellectual disabilities have changed over time. We're going to describe how we measure intelligence, and we're going to talk about standardized testing that psychologists use to determine impairment. And then we're going to talk about how IDs affect developmental course, language, social development, emotions, and behavior across time. We're going to talk about the different causes of intellectual disabilities, and then kind of go into specific syndromes and abnormalities associated with IDs. And then we're going to talk a little bit about appropriate treatment options for people with intellectual disabilities. So in the DSM-5, one of the diagnostic criteria for an ID is to have a deficit in intellectual functioning. So this is the basic idea of having an ID. It's that there's some sort of impairment in intellectual functioning. And then, like I mentioned earlier, you also have to have an impairment in adaptive functioning. So that difficulty you're having intellectually has to translate into impairment in your day-to-day life. So meaning social functioning or academic functioning or professional functioning or in the family. So you have to have this intellectual deficit paired with impairment in adaptive functioning. And then, like I mentioned before, these characteristics must be present early in development. So these are not things that begin later in life. They are things that are neurodevelopmental, and they begin early in life. So in the DSM, you can specify severity level for intellectual disabilities. So you can get an ID with mild, moderate, severe, or profound severity level. According to the DSM-5, this severity level is determined based on the supports an individual needs in their life. So it's not just based on IQ. So it's not like we give children an IQ test and then we use that score and we give them severity level. Instead, we are trying to determine through clinical interviewing and other assessments that we'll talk about a little bit later, how much support does this child need in their environment, and then we come up with severity level based on that. So briefly, to talk about historical perspectives on intellectual disabilities, kids with intellectual disabilities were, over much of human civilization, thought of as people who are possessed by the devil or deviants of some type. Sometimes they were kept for entertainment in some cultures, sometimes they were abused. This is something that is not not something that we should be proud of as a society or as our culture. So we basically, the view was that these individuals are not to be valued. Um, the eugenics movement, here's a quote from the eugenics movement. This country has so far taken no steps to segregate these irresponsible persons, so the number of them is constantly increasing. So here is someone talking about this idea that these irresponsible persons, meaning people with intellectual disabilities, are problematic and they need to be segregated, meaning kept apart, and we need to keep them from increasing. So we need to basically sacrifice the needs of these individuals in order to prioritize the needs of society. Basically, kids and adults with intellectual disabilities were viewed as a menace that needed to be controlled. So in 1910, the eugenics movement basically put forth this idea that influences that improve the inborn qualities of a race should be preserved. So things that we want to see in our race, we should try to preserve those qualities, and then qualities we don't want to see preserved in our race, we should try to get rid of those. And then along with these ideas, there was this belief that individuals with intellectual disability lacked moral fiber. So somehow intelligence got sort of tied up with morality. And so that's where this term moron comes from. A moron is someone who's seen as a moral imbecile or someone who's lacking morality. And so here's a YouTube video, this is a link to a YouTube video for you guys to watch. And so if you could pause the lecture recording and then watch this video and do this extra credit activity. I'm going to post on Canvas a way for you all to submit this. So if you want to get extra credit for participation today, you can submit this via Canvas. Basically, after you watch the video, you should be able to answer what major factors led to the eugenics movement, what are the major problems with eugenics, and what current day controversies may relate to the eugenics movement. Okay, so you can go ahead and pause the recording and do that. So thankfully, the humanist movement, which began in the 20th century, is basically a movement towards humane care. So this is towards humane care of kids with intellectual disabilities as well as adults. This movement was primarily begun by parents of children with intellectual disabilities. So parents of these children sort of got together to stimulate research to figure out how to prevent these disabilities, how to care for kids with these disabilities. Okay, so now we're going to go through some of the main tests for measuring intelligence. So the first intelligence test created was the Stanford-Binet. This test was created as a way to identify children in school who needed help. So this test wasn't necessarily created to measure IQ or intelligence in all people or in the general population, but more a way to identify kids who needed help in school. So it is better at measuring differences in IQ in the lower range as opposed to the IQ differences in the higher range. So IQ stands for general intellectual functioning, which is defined by the intelligence quotient or IQ. This is measured by intelligence tests, and in terms of aspects of IQ, there are different elements, so they're verbal, visual, spatial, and mathematical skills. IQ is stable by age 4 or 5. So if you measure IQ in infants or young toddlers, you're not going to get a reliable IQ, meaning that your IQ at age 1 doesn't predict your IQ at age 2. But by the time children get to be around 4 or 5 years old, IQ is relatively stable. So today we have these IQ tests, so the Wechsler Intelligence Scale, or the WISC, the Stanford-Binet, or the Kaufman Assessment for children. These are just some examples of some standard IQ tests that are used. So you guys have probably seen this before, so this is just showing the distribution for IQ scores. So if you look here, 100 is perfectly average, so you can see that if you go up from 100, you're going to have the most amount of people who are going to get this score of 100. If you go one standard deviation up to 115, Then you're going to be in a lower section of the population, so 14% of people have an IQ between 115 and 130. And then if you go the other direction, the same thing. So 14% of people have an IQ between 70 and 85. And then if you go even further out on the tails, between 55 and 70, 2% of people have an IQ in that range. And then between 130 and 175, 2% of people have an IQ in that range. So you can sort of see how this distribution is distributed. So most people are going to be, 95% of people have an IQ between 70 and 130. And the other thing to mention is IQ scores are all relative. So your IQ doesn't increase across time as you get smarter from, let's say, age 7 to age 12, but rather IQ scores are normed based on the age population you are in. So an IQ for a 7-year-old, 100 will be the average, and then that same 7-year-old, by the time they're 12, their IQ, if the test is doing what it should still be average, meaning it will still be 100. It's not that they have gained IQ points. Okay, so in terms of what we talked about earlier, adaptive behavior components, this is referring to thinking about how kids are actually functioning in their day-to-day lives. So IQ is sort of a measure, thought to be a measure of general intelligence. Adaptive behavior components are how kids function in school settings or in social settings. So elements of adaptive behavior include communication, which can be expressive, meaning the way they're speaking, receptive, that's sort of listening, and then written communication. And then daily living skills are composed of personal living skills, domestic, meaning at the home, and then community living skills. And then we also measure socialization, so kids' abilities to hold relationships or form relationships, to play with other kids, and coping skills, and then motor skills, so fine meaning small motor skills, and gross motor skills meaning more larger motor skills like walking. So some children adapt well to their environment despite having lower IQs. So some kids may not do well on an IQ test, but for whatever reason in their environment, they are very adaptable. They are not having major impairment in terms of their day-to-day functioning, their socialization, their ability to communicate, or their motor skills. So according to the DSM, these kids would not be considered to have an intellectual disability. So one of the ways that adaptive behavior is measured is with the Adaptive Behavior Assessment System. Or the Vineland Adaptive Behavior Scale, or the VBAS. So there are some controversies around IQ. So people have wondered whether IQ is a stable trait. They've thought a lot about, well, doesn't the environment matter for IQ? So it seems like environment does matter, sort of. So IQ is, like I mentioned earlier, it's measured in relationship to age. So all the IQ scores one would be given are normed in relation to the age group one is in. So like I mentioned also, IQ in infancy is not stable. Before the first birthday, it is not stable. But by around age 4, IQ is going to be pretty stable. So your IQ, for example, your IQ at age 4 is highly correlated with what your IQ at age 12 will be. So 0.77 is the correlation. So that's a pretty strong correlation. So basically by age 4 or 5, we are pretty good at measuring your general intelligence. Children with intellectual disabilities, however, have different trajectories. So the data I had just presented to you about IQ being stable by age 4 or 5, that's in normative populations. So amongst kids with intellectual disabilities, at lower IQ levels, meaning below 50, IQ is very stable even in infancy. So if your IQ is low enough, even in infancy, your IQ will be relatively stable. Your IQ is less likely to change if it is that low. Environmental circumstances can help, so environmental support can be helpful. And we know that infancy through early childhood offers the most significant opportunity to help brain development. So this seems to be a critical period or an important period early in lifehood where support seems particularly useful, or intervention. So the Flynn effect, you guys have probably heard about this, is basically this idea that IQ points are rising by the decade. So every decade, IQ scores are going up about 3 points. So we have to re-norm IQ tests or standardized IQ tests every 15 to 20 years. And we basically have to reset our mean to 100. So how do we explain this? Why would general IQ be going up? So here's a YouTube video to watch. You can copy and paste that into your browser. And this video goes into more detail about the Flynn effect. But I'll go into a little bit of detail here. So there are some theories about the Flynn effect. So one is that IQ is increasing due to rising standards of living. So basically having access to medical care, having adequate nutrition, having better education system, all of this may relate to this increase in average IQ. Better schooling, so it could be that we're just doing a better job of educating our kids. Better nutrition, we know nutrition has a lot to do with intellectual functioning. Medical advances, like I mentioned. Maybe just basically more stimulating environments. So the social world, the political world is a more complex world in some ways than it used to be. It may be that a lot of information processing is required. Social media, one could make an argument, I think, either way, but one way that argument could go would be that our environments now are more stimulating and require more intellectual functioning due to being more stimulating. We also have a more child-focused parenting style, so kids used to not be sort of the center of attention or prioritized in the family dynamic, and for the most part in the last 50 years that's been shifting, and this could be leading to increases in intellectual development early in life. And then basically more complex daily life experiences, so having to navigate more complicated systems in any number of ways may be leading to this increase in average IQ. So it should be something that you note that IQ tests are not completely unbiased. So we do know that we observe lower IQ scores for African American kids, which may be due to actual things in the real world. So this may be due to lower quality schools, lower income neighborhoods. Could be due to poor nutrition or inadequate prenatal care, maybe just fewer resources in general. So that's one thought about this. It also could be that part of what we're measuring on IQ tests are cultural knowledge. So, for example, one item on an IQ test for little kids, for small children, is could be something like, what would you do if you found an stamped and addressed envelope on the ground? And the answer they're looking for is, put it in the mail or bring it to the post office. But it's possible that a child raised in a neighborhood that's lower income may not have that cultural knowledge about mail or the post office, or maybe a kid living in a certain place where mail isn't accessible, or you can think of a number of reasons. But the point here is that maybe even though we're trying to make IQ tests not about cultural knowledge, in some ways it is impossible to disentangle cultural knowledge from just standard intellectual testing. So intellectual disabilities are present in about 1% of the population. They affect slightly more males than females, so 1.6 males to every 1 female. This may be due to X-linked genetic disorders, so this may explain why there's slightly more prevalence of intellectual disability in males versus females. So there's this controversy about whether kids with intellectual disabilities progress through the same developmental milestones in the same sequence as normative kids, but just at a different rate, or do they go through a completely different developmental trajectory altogether? So it could be that kids with intellectual disabilities develop in a completely different, less sequential, less organized fashion. So far, data on this suggests that kids with intellectual disabilities generally seem to follow the same developmental stages, but just in a delayed fashion. So it doesn't seem like they have an altogether different developmental trajectory, but just one that is delayed. So the kids with intellectual disabilities seem to follow the same developmental stages in the same order as normative kids. Their goals and motivation may decrease over time. So they may get frustrated, they may feel helpless, they may start to see themselves as failures, they may start to expect failure from themselves and from others as well. And so this could potentially lead to a troubled trajectory. However, adaptive skills can improve with training. So even though a child with a generally low IQ may have trouble in applied settings like school or with family or friends, there are ways that we can train kids to be more adapted to their environments. So in terms of language and social development, kids with intellectual disabilities do tend to have difficulties with expressive language, meaning speaking. They tend to have difficulties with development of secure attachment, so attaching with their caregiver. This could have something to do with having difficulties with expressive language, having difficulties with expressing emotion. So those difficulties may lead to difficulties with attachment to the caregiver. They do seem to have an impaired sense of self, meaning the ability to recognize oneself in the mirror, having that internal state of language. So we all sort of have a dialogue or a monologue, rather, in our internally, that sort of making comments about the world and about the self. And kids with intellectual disabilities may have an impairment in this ongoing verbal process due to difficulties with expressive language. This may lead to deficits in social skills and social cognitive ability, and that generally can lead to peer rejection. So this is why it's important to think about ways to include kids with intellectual disabilities into other groups of kids their own age, to sort of decrease the impact of this deficit, this potential deficit in social skills. Emotional behavior problems are more common in kids with intellectual disabilities. So 3 to 5 times kids with intellectual disabilities have 3 to 5 times more likelihood of having an emotional or behavioral problem relative to normative populations. This may be due to having, like I mentioned, the limited communication. So limiting someone's ability to express themselves could lead to emotional or behavioral problems. So, for example, if a child wants, a piece of candy, instead of being able to ask for it, they may have to throw a tantrum to get it. So that could lead to some behavioral problems. Kids with intellectual disabilities also have additional stressors relative to normative populations. So we know stress relates to anxiety and depression, so that could be one reason. These kids have increased emotional behavioral problems. We also know that intellectual disabilities may be related to neurological deficits, and those neurological deficits may also be related to emotional and behavioral problems. So, for example, kids with intellectual disabilities are more likely to have ADHD or mood problems. They may be more likely to have pica or self-injurious behavior. So if you remember from earlier in the course, we talked about pica, that's eating objects that are inedible. And there are a number of other disabilities related to intellectual disabilities. So epilepsy is more common in kids with intellectual disabilities, cerebral palsy, anxiety disorders, oppositional defiant disorder, or basically externalizing disorders, Down syndrome. Down syndrome is also related to some other medical issues like congenital heart disorder and respiratory infections. Kids with intellectual disabilities are also more likely to have autism. So there are these two types, I guess, or types of causes that are thought to be related to intellectual disabilities. So one is this organic cause, meaning that there's a clear biological cause of the disability. And in kids with the organic intellectual disabilities, they have moderate to profound, meaning a very severe disability. We don't see any ethnic or socioeconomic differences in these kids with organic disabilities. They also tend to have physical disabilities. When kids have organic causes of intellectual disabilities, they tend to have had issues prenatally, so sometimes genetic issues, accidents in utero. Sometimes they had they're premature babies, or they have oxygen deficiency issues. Some of them have head trauma or exposure to lead. So those are the sort of the organic causes of intellectual disability. And then there's the cultural familial causes. So these are basically there's no obvious cause to the disability. These kids tend to have a more mild disability. The rates of these disabilities are higher in minorities and kids in low socioeconomic status families. They tend to have fewer other disabilities, so they don't have as many of those other physical disabilities. We think of these kids as basically having a polygenetic or sort of multiple genes that relate to their tendency to have low IQ. So in these kids, their parents tend to have lower IQs. They tend to also be kids who are in poorer environments. So they tend to have poor nutrition, poor child care. They tend to be experiencing more poverty. So in the cultural familial type of intellectual disability, environment seems to be playing much more of a cause relative to the organic causes of developmental or intellectual disability. Okay, so now we're going to go through a few specific examples of causes of intellectual disabilities. So Down syndrome is one type of intellectual disability. This has to do with a chromosomal abnormality. This is the most common kind of intellectual disability. This is basically the failure of the 21st pair of chromosomes to separate. So you end up with 3. So you should have 2 of each type of chromosome, but instead of 2, you have 3 21st chromosomes. So it's trisomy 21, meaning 3 of the 21st chromosome. This is relatively uncommon. So 1 in 1,000 births of moms 35 years or younger have 3 of the 21st chromosome. This becomes higher risk with increased maternal age. So after 36 and older in moms, it goes up. So 20 out of 1,000 births become kids with Down syndrome. So there are some distinct physical features of Down syndrome, which you can see in this picture here. A larger tongue, a smaller mouth. Those are some physical features. Almond-shaped eyes, the sloping eyebrows, and then you can't see this in the picture, but broad, square-like hands. So there are some ways you can recognize kids with Down syndrome. Another chromosomal abnormality is Fragile X syndrome. This is the most common inherited intellectual disability. This occurs in 1 in 4,000 males and 1 in 8,000 females. This is associated with a specific gene on the X chromosome, the FMR1 gene on the X chromosome. This is 2 times more common in males than females. So you can see this in this picture right here. There are some subtle physical features associated with Fragile X, a larger forehead, a prominent jaw, and then those protruding ears that you can see here in this picture. Fragile X syndrome is characterized by unusual social and communication patterns. So these kids tend to be more shy than average kids. They tend to have poor eye contact. They have delays in cognitive and communicative development, so it's harder for them to speak and communicate with other kids. They tend to have more social anxiety. So it's not that, so all kids with intellectual disabilities tend to be more anxious, but specifically kids with Fragile X have more social anxiety. Half of the kids with Fragile X will also meet criteria for autism. And so here's a video, a YouTube video that goes into more detail about an example of a child with Fragile X syndrome. So another chromosomal abnormality is Prader-Willi syndrome. This prevalence is about 5 to 10 out of every 100,000. This abnormality has to do with chromosome 15. And basically, kids with Prader-Willi are characterized by what is termed as failure to thrive, basically meaning these kids are shorter than they should be. They tend to have floppiness in their limbs, so you can kind of see this in this image here. Incomplete sexual development and extreme overeating, which can lead to obesity. And they tend to hoard food, and this may have to do with that increased appetite that they experience. Another chromosomal abnormality that leads to intellectual disabilities is Angelman syndrome. This is another abnormality on chromosome 15. There are some characteristics specific to this. So Kids with Angelman tend to have moderate to severe intellectual disability. They tend to have a unstable, stiff, jerky gait. So the way that they walk is notable. They tend to not have speech skills. They tend to do hand flapping behavior, and they also tend to have seizures. And then an open mouth expression, which you can see in this picture. Another chromosomal abnormality that can lead to intellectual disability is PKU. This is basically when kids lack a liver enzyme that's needed to convert an amino acid, phenylalanine, I don't think I'm saying that right, into tyrosine, and it's a recessive gene transmission. So it's something we can test for in parents to see if they have a genetic tendency towards PKU. And this can actually be treated. So with strict dietary restriction, we can prevent intellectual disability in kids with PKU. If we don't do that strict dietary restriction, this can cause brain damage, intellectual disability, hyperactivity, and seizures. Okay, in terms of thinking of general neurobiological causes of intellectual disabilities, we know that exposure to toxic substances can cause neurological problems that can lead to intellectual disability. Like I mentioned, prenatal or perinatal stressors can lead to intellectual disabilities. Maternal infections while pregnant can lead to certain intellectual disabilities. Trauma or lack of oxygen, especially during birth, can lead to intellectual disability. General malnutrition, accidental poisoning. And then specifically fetal alcohol syndrome is a specific cause of intellectual disability. And kids with fetal alcohol syndrome are characterized by abnormal facial features. So if it wasn't already obvious, fetal alcohol syndrome is caused by women drinking during pregnancy. And so when that happens, their kids can have fetal alcohol syndrome, and it's characterized by some of these facial features. So you can see that in the image here. So having a relatively small forehead, having a low nasal bridge, so sort of appearing to have more of a flat nose, small eye openings, a shorter nose, basically all around flatter mid-face, that smooth upper lip, and an underdeveloped jaw. Those are all physical features of fetal alcohol syndrome, or FAS. FAS is also associated with some growth deficiencies, some issues related to the central nervous system, and then, like I mentioned, intellectual disability or general learning disorders. Kids with fetal alcohol syndrome tend to have problems with memory, their attention, they can have difficulties hearing and communicating, and problems with their vision. Fetal alcohol syndrome is 4 times higher among African American kids and 16 times higher among Native American children. Okay, so in terms of treatment for intellectual disability, we know that early intervention is helpful. So academic enrichment programs can be really helpful for kids with IDs. And behavioral techniques are also very helpful for kids with intellectual disabilities. So we can use behavioral techniques to increase language skills, increase adaptive skills. We can do social skills training. Basically, positive behavioral support can be extremely helpful for kids with intellectual disabilities. We can also use some cognitive techniques, so we can do some training in self-regulation and also some more specific learning strategies for kids with intellectual disabilities. And then oftentimes families with kids with intellectual disabilities need help in terms of coming up with coping strategies for specific behavioral problems, just basic support and guidance, and then access to services like providers that come into the home to help with some of these support techniques. There are some drug treatments, but these drug treatments are not for intellectual disability, they're for specific behaviors. So kids with compulsions or aggression, we can use pharmacological treatment to target those things, but we can't use drug treatment to target the intellectual disability itself. The Individuals with Disabilities Education Act, or IDEA, is basically a law ensuring that kids with intellectual disabilities are guaranteed services. They're guaranteed an adaptable curriculum according to their needs, and they must be in the least restrictive environment, so meaning they should have as most freedom as they can. So this has a lot to do with schools or residential. treatment. So if kids need residential care, they must be provided with it. So this is the IDEA Act. And then just to close with this idea that we've talked about this with all psychopathology, but this is especially true for kids with intellectual disabilities. The individual is an important aspect, obviously, of the disability, and then interpersonal functioning, and then organizational, meaning schools, and community, meaning the place where kids live. But one of the biggest things that is important for determining what's going to happen for kids with intellectual disabilities is on the public policy level. So that IDEA Act is an example of that. That has had a huge impact on how things go for kids with intellectual disabilities. So policy is very important in terms of the outcomes for kids with IDs.